Brock lives in an abandoned school that the city of Knoxville leases to Ram for $1. Until recently, he took showers in the courtyard with a hose.
When we see what we've seen over the last weekend, how do you pay for all of that?
In the first place, we really know how to stretch the dollar. We operate entirely on the generosity of the American people. I'd like to say that we had big corporate support in America, but we don't. So there's those little checks from those people that send in the $5 and the $10.
Ram operates on a shoestring, about $250,000 a year, and yet last year it treated 17,000 patients. On this Saturday, there was no sign of a let-up.
What have you accomplished today?
Well, we've basically had 600 or so people that have arrived here overnight, and we were able to do just about everybody. I think we may have turned away about 15 people who are going to come back tomorrow morning anyway.
The next day, Sunday, there were hundreds more. Tickets started again with the number 1, but now the doctors were racing time. In hours, they'd be headed home.
Who's got 361? 362? 362, 363.
And we're really glad that you came in, especially given...
Nurse practitioner Teresa Gardner was worried about Rebecca McWilliams. McWilliams had surgery for cervical cancer in 2005, but without the recommended follow-up.
How long has it been?
It's been about 2 years since I've had my last pap smear, and I was supposed to have every 6 months, and I've really only had it once since that surgery.
You know, I think many doctors would say you've taken a terrible risk.
Yeah.
Waiting this long.
I really have, but it's just, like I said, it's very hard to afford it. I have 3 kids, and my husband lost his job this past summer.
McWilliams' pap smear came back clear, but in her exam, Gardner found reason to worry.
I think just from, the clinical inspection of the cervix, that, possibly there is possibility of that cancer, still being there.
She was 28 years old.
28 years old, the mother of 3.
You've created this medical organization that was designed to go into third world countries, to go into remote places, and now you're doing 60% of your work in urban and rural America. What are we supposed to make of that?
That for 50 million or so people in this country, the one thing that is on their mind is, what if I have a catastrophic event, a car crash, heart attack?
Because they don't have health insurance.
Because I either have no health insurance or I'm underinsured. And so this is a very, very weighty thing to be thinking about, knowing that your family is in great jeopardy. 376, 377, 378, 379, 380.
Late on Sunday, Joanne Ford's number was among the last to be called. We found her sitting by a stairwell.
And you don't have that?
Well, no, not on a Social Security disability income.
She's retired, living on disability with no insurance, and her glasses don't work anymore. She got in, only to find out that the vision care line had closed.
How is your vision?
I bet in my left eye it's probably, I couldn't see your face. The Lord will take care of me. The Lord will provide. The Lord will provide.
But not today.
But not today. So I got to look for another option, but I'll find one.
What are you going to do?
I don't know. I have a lot of good friends, and I have a lot of church support. I was very active in my church. I have a lot of friends at church. I just hate to ask. I've worked on my wife. I hate to ask. That's why things like this are so wonderful.
There is no shame in seeking health care.
No, you're right. It really, I am sad that we are the wealthiest nation in the world and we don't take care of our own. So, but it will be okay.
And it did turn out okay after all. Someone at RAM noticed Joanne's situation. They put her in the vision care line and examined her for a new pair of glasses.
If I may have your attention, please. I'm afraid that we've got some rather disappointing news.
But at the gate, many were waiting when the weekend ended.
449 and 450.
In the expedition to Knoxville, Ram saw 920 patients, made 500 pairs of glasses, did 94 mammograms, extracted 1,066 teeth, and did 567 fillings. But when Stan Brock called the last number, 400 people were turned away.
What's going through your mind when you're reading off the last 2 or 3 numbers and you see so many more people at the gate than are going to be able to come in?
Yeah, well, you know, that's the lousy part of this job. I mean, it's nice to, you know, to be able to know that you've helped a bunch of people, but the reality is that we can't do everybody. At the moment, we're just doing the thousands and thousands of people that we can, and the rest of them, unfortunately, have got to do the best they can without us.